Hello and welcome to SPAG Fin Dialogue Podcast. SPAG Fin Dialogue is a content platform that builds strong and relevant conversations, amplifying the voices of various stakeholders in healthcare and technology to help our audience stay engaged and informed. I am your host Divya, and today, on the occasion of World Immunization Week, we will delve into a topic that's particularly important in the Indian context: ensuring vaccine equity. And what better way to do that than to talk about the success roadmap of the COVID-19 vaccine rollout? The COVID-19 pandemic has presented significant challenges, but the development and distribution of effective vaccines are providing hope and progress towards a brighter future. We are steadily making our way out of this crisis through collective efforts and scientific advancements. India has been at the forefront of the COVID-19 vaccination drive, with millions of doses being administered every day. There's still a lot to learn from the COVID-19 vaccination initiatives, learnings that can be implemented in regular immunization drives. Our special guest today is Dr. G.K Soni, the Project Director, Momentum Routine Immunization Transformation and Equity. We are excited to have him here to discuss the Momentum Routine Immunization Transformation and Equity project and its contribution to improving routine immunization coverage and promoting equity in communities. Welcome, Dr. Soni, and thank you for joining us today.
Thank you. Thank you, all of us. It's a pleasure to be here.
So, Dr. Soni, can you tell us about the Momentum Routine Immunization Transformation and Equity project? What were its key strategies and approaches used?
Sure. So the Momentum Routine Immunization Transfer Project is USAID funded project, which is supporting ramping up of COVID-19 vaccination in the country. And with the support of the Ministry of Health and Family Affairs, 18 states have been assigned to us, where this project is supporting the state governments for improving the COVID-19 vaccination. So we have started the project in the month of August 2021. And in the phased manner, we have started deploying our human resources in the field as well as engagement with our partners for supporting those activities. So the main focus of the project was to generate the demand and community engagement, because there were some vaccine hesitancy pockets were there are some reluctances are there, and myths were there. So the main focus of this project was to generate the demand generation and community engagement, with a special focus on social and behavior change communication activities and some advocacy efforts. Also, we are providing the technical assistance at the national level as well as at the state level in the assigned states. And these states are being identified by the government of India based on certain indicators at that time when we started the project. So we have our main target was the vaccine should reach equitably in all the hard to reach areas which are difficult and accessible, because there are certain regions the vaccines cannot reach to far flung areas. So we have to support those areas where the equity angle has to be completed, not only for the gender wise, along with the marginalized and vulnerable population. Everyone should be able to receive the vaccines, whether it is a disabled population, whether it is older age population, whether it is a migrant population or nomadic population. So equitable distribution for the vaccine is important target area along with the demand generation. Then supporting the system also, broader health system, how we can support the broader health system to improve the COVID-19 vaccination, along with the improvement in the cold chain, training component, supportive supervision, and some parts of the monitoring also. So we have also supported to build up the strong health system in the activities where vaccine supply management and health information system and the digitalization, the COVID platform. We have supported for the rollout of the COVID part, rollout also in the field, and some of the important training components along with that. Not only this, we are able to showcase the partnership and collaboration in the field. So we have done the partnership in the field with the local NGOs, by which support we are able to engage the communities, and the community mobilization part was easily executed. So the partnership and collaboration was one of the key components of this project, and we are able to showcase how we have done a partnership in the field, by the virtue of which we are able to vaccinate a number of benefits, because we are able to facilitate nearly more than 15 million beneficiaries for this marginalized and vulnerable population. So this project is not only focusing on the specific areas or the states which were assigned to us, not only the districts, but we are focusing on specific pockets which are unreachable or inaccessible, hard to reach within geographical region, whether it is tribal population or whether it is transgender community which hesitate to come to the vaccination sites. So different multi-pronged strategies have been opted to this project, and we are able to do those activities in that. Over.
Well, great. So, coming to the pandemic, COVID-19 vaccination has played an important role in battling the pandemic. Can you highlight a few innovations or special initiatives undertaken for COVID-19 vaccine implementation? Like, what were the special initiatives employed for the COVID-19 vaccination drive and overcoming the barriers to its implementation?
So everyone knows the COVID vaccination was the topmost priority of the government of India and the state governments, because everyone was affected due to COVID vaccination or COVID disease. So the community engagement was important. The slogan which was taken by government of India, Jan Bhagidari, that is an important aspect of this project also, which has proved a lot of activities to support in those areas. So the Jan Bhagidari, the contribution of the community was one of the important approach which has taken to improve the COVID-19 vaccination uptake. Along with that, what I have mentioned, the partnership at the local level. So we are able to engage nearly 26 NGOs in the field who have their original footprints in the field, whom the community is very well versed of, and whom they are aware how the community can be mobilized in that particular area. So we have engaged the local NGOs in that particular community who are already working either in the health sector or in other sectors, and who have day-to-day coordination with activity, these community members, so that the community trust on them. We utilize the trust the community is having for these activities, and that has helped to engagement of the four local NGOs. Along with that, the faith-based leaders. These are the important leaders who have supported this activity in the areas, whether it is Christian community, whether it is minority community, whether it is Hindus, whether it is Muslims, whether it is Punjabis, whatever the religions are there, every religious leader has supported that. And we have tried to onboard those religious leaders in the particular community who have supported us for this campaign in that particular area. So the community engagement was important. Engagement of the faith-based leaders is very important for us. Along with that, Ashas are the local volunteers in the field. They have also supported for that area. The elected panchayat leaders, PRI, they have supported in these areas. The education department has supported those areas. So all the departments, the line departments have supported for this area. But we have, through the project, we are able to engage as much as faith-based leaders for this and local NGOs in the area, which have supported this. Not only this, we have identified some specific NGOs who are working for the disabilities. That is an important component, because the people with the disabilities are not able to reach the session sites by themselves. They need some support. So we have identified the organizations who are supporting for the disabilities, organizations who are supporting for the older age group, especially the older age group, the old homes and reward homes. Those activities are being taken by this. We have focused on the transgender community. We have focused on the pregnant and lactating women. We have engaged the organizations who are supporting for these females and pregnant women and lactating women. So multiple activities have been taken for the youth also. The youth clubs have been engaged for these activities. For migrants and laborers, we have engaged the industrial associations for that. There are multiple activities we have supported. We are able to support the vaccination through mobile teams. So in mobile teams, it is not only the what we say four-wheelers. Whatever the transport medium is required by the state government, we are able to support that. If the boats are required, we are able to support with the boat. If they require camel cart, for example, in desert areas, we have provided the support through our NGOs for the camel cart to reach the last mile areas. Night camps were organized to cater the daily wage workers, because they are going for their daily earnings in the morning, coming in the night. So special provisions were taken care for them, who either in the early morning sessions or the late evening sessions were conducted. Ratri chowpals were taken care, in which the community awareness were done in the night gatherings which happen in the rural areas.
Mhm.
Workplaces, we have identified the workplaces for the opportunity to leverage those activities. So multiple innovative approaches have been taken care to target the specific group of population which is requiring for the COVID vaccination. For schools, the games were identified. In the schools, we are able to play some board games and flashcard games to create awareness in the community, in the students, which in turn not only getting their awareness, but they're imparting the message in the community and the families also. So that has helped us, like we have done in other immunization activities like that. Local folk artists were engaged in the particular community because they are specific. They are able to communicate. In the previous era, we know everyone knows we are able to show. They are able to showcase how the folk artists help in passing the message in their local language, in their local dialects, which they understand very easily. So that means the street plays, the local artists were done in the geographical area in different folk activities which were conducted in local areas. Not only the mass media has been taken care, but the local folk artists have supported to create awareness in those areas. So there are multiple activities in which we are able to this. The translation of the communication material in the local language was one of the activities. Because at the national level, the actual IC materials were published either in English or in Hindi, but we are able to translate those local in the different local languages which is required in that particular last mile area. So we have done multiple activities for communication of these areas to create and generate the demand for the COVID vaccination in the community. So different activities were taken care for the different communities which we have targeted through our project activities. So multiple engagements have been done overall to improve the activities in that. And again, I am repeat, the partnership was very important. The partnership not only with our NGOs, but these NGOs have in turn done local partnership at the field level. So multiple partnerships have been taken care through our NGO network in the localized area where it is required by themselves. So the fight against COVID vaccination is the collaborative effect of all the human beings who are communities, who are the societies. Everyone has supported for this COVID-19 vaccination coverage. So I think everyone has contributed a lot. We are the part how to push those activities, how we can provide support to the state government. Ultimately, the government of India has done a lot in this area. The state governments have done a lot in this area. So we have played a catalyst role in this area to augment how we can support this COVID-19 activities. So definitely, vaccines are provided by the government of India. Human resources are provided by the government of India and at the state governments. So we have provided the support, the additional support which they require on immediate basis and urgent basis, so that our teams are able to do as much as possible to support those activities in the community to generate demand for COVID-19 vaccination. So that was, I think we have done a lot. I think I cannot ever, I think I have missed many other activities because we are working 18 different geographies and every state has different challenges. Every state needs every innovation differently. Even the districts need different innovation in that area. So team have done a lot of efforts to improve the COVID-19 vaccination in that area. Oh,
So, thank you, Dr. Soni, for sharing those details. So, while implementing this project, one must have faced various barriers and challenges. Could you highlight some challenges and methods used to overcome these challenges, especially with the most vulnerable groups, such as tribal groups, transgenders, the elderly, etc.?
yeah, definitely. As you are aware, vaccine hesitancy was some of the important challenge which everyone has faced because this was a new vaccine when it was introduced. Even the health sector was also have hesitancy to go for the vaccination. But thanks to the leadership at the national level and at the state level, the transparent communication which has taken care of this, showcase how this vaccine is effective in the area, showcase as a piloting and a modeling by taking coming forward to get the vaccines. The head of the institutions come forward to showcase that we have received the vaccine and that has been highlighted in the media. So the vaccine hesitancy was one of the important challenge for this vaccine when the vaccine was rolled out initially. Over a period of time, when we have n number of vaccination conducted, that through the media and through the community messengers, we are able to showcase this. Just see, we are able to do n number of lakhs of vaccination. Nothing adverse event has happened so far in these areas, and everyone who has received the vaccine got benefited. So evidence-based communications were developed based on the similar lines that has given to those areas. You have mentioned the tribal communities and other far-flung areas, communities which are living in this area. We are aware the communication with them is hard to understand because they have the low literacy level as compared to the literacy level in other parts of the country. So to communicate with them, we have to identify the local influencer in that particular community so that they can easily communicate them, easily convince them. So local influencers were identified in that particular community, in that particular tribal areas, who can further communicate them, and we are able to get through those vaccination in that particular area. Definitely hurdles were there. It took time to convince the population, to set the example in front of them, to showcase, yes, this vaccine is safe and it is protective for the COVID disease. Because in the tribal area, in the local farming area, they say it is a God gift. They have to accept this. There are multiple myths and the failures in that particular area. So to address those areas, we have to take care of the culturally sensitive communication activities in that particular area. So different population have different geographical challenges. So we have to communicate based on their particular communication areas, and we are able to come out with a local influencer in that particular community, whether it's a tribal community, whether it is transgender, whether it is migrant population, whether it is a labor class. So whatever it is area, we are able to come out with this. Faith-based leaders, they have come out very well. So we are able to engage the faith-based organizations also, which have spread the vaccine confidence in the community, especially in the Christian community. We are able to engage the leaders of the churches, and we are able to organize the camps at the churches on the Mass day, on the Sundays. So that has helped us to demonstrate how we are able to vaccinate in those particular area to allay the fear of this bacteria. In Jammu and Kashmir, in Srinagar, I think, in the Dal Lake, the Shikara teams, we went to the Shikara houses, houseboats where, because they are not coming out for the session sites. So we reached up to them, organized the session, convinced them for this vaccination, because everyone say how the virus will come. Virus doesn't have the borders, virus doesn't have the any boundaries. It can cross anyone anywhere. So we have provided those activities in that particular area through those particular communities in that area. Like in schools, students are hesitant to receive the vaccine. It is very difficult to convince the students also because they are young generation. In children, it is easy to vaccinate because the parents are coming with the children and the children are not aware of the vaccines, the pain of the prick. But in the adults, it is very difficult to convince the youth group. So we are able to convince those youth groups through messengers, identify the ambassadors in the schools who try to convince them and motivate all the school children. So we have organized some special days also to create awareness, whether it is Women's Day, whether it's World Health Day, whether it is Children's Day, Diwali, Dashera, or whatever the festivals are there. We utilize all those special occasions to create community awareness in the community, broadcast the messages through the mass media, through the radio, FM radio, TV channels. Local TV channels are also used for this particular activity in this area. The tea gardens, the population, the labor class living in the tea gardens, the estate of the Assam, we are able to reach nearly 15,000 beneficiaries in those areas through our vaccine drives. So we are able to reach those particular areas with proper strategy, with the engagement of the government. We have taken government at everywhere because ultimately the responsibility is for the government. The government, we are identifying the pockets, we plan the activity in that particular area, create awareness, then organize the session in the area with the support of the government. So government has also taken an initiative to reach, to convince all these population for COVID-19 vaccination in the country. So it was really definitely uh, collaborative effect of each and everyone. So government of India has started Har Ghar Dastak program, knock every door to identify who was left out and organize the session in that particular community. So that was a very important step which the government of India has taken to Har Ghar Dastak. Then during the Amrit Mahotsav campaign, these are the special campaigns in which government try to ensure that each and everyone for the due beneficiary should be vaccinated for the vaccines. Many activities have been taken care to reach the vaccine and to allay the fear of the community for the vaccination. So thanks to, I think everyone has contributed a lot for this activity in the reaching out the last mile for the vaccination.
So, the project followed the model of harnessing local community driven approaches while working with the local NGOs. Could you speak about your experience in working with the local partners that have helped drive ground level impact?
Yes, this was a good experience for us also in the project. We are able to engage with the local NGOs who have their footprints in the field. It was a really good experience for us also, and that has laid as an example. In a short period of time, we are able to enroll 26 NGOs with our organization to support 298 districts in the country. So, when it's short duration, I think we are able to do this, and the local presence has given a very good result because they have the strong relationship with them. The local leaders knows them very well. The community knows them very well. They have their respect and trust in the community. So the existing trust, we are able to utilize that trust of the community to reach them, to communicate them, which has given a valuable effect to reach and expertise because they are expert in dealing with those communities. From here, from national level, we cannot go and ask the community to, okay, you take the vaccines. But being the local volunteers in that particular area, if they will say, the community will definitely listen to that. So we provided with the facts and figures to these local leaders and the local influencers and the local NGOs. We oriented them, we guided them. Based on those discussions, they have further taken up with the community to reach those challenges which were there in the community, to motivate them and to bring them to the session site to receive the vaccination. So I think the trust what they are having with the community has given a very good result for the COVID-19 vaccination, especially in the areas where we have supported through our project activity. And this is the legacy I think we are leaving behind. This is the first time I think we have engaged like the health department, like the NGOs who are supported in this particular area. And I think this model should work for other health system standing activities and other health programs also. How these local NGOs can create community awareness and how this community can be engaged and onboarded for other health system disease programs or other health system program in the dish. So we have built the capacity of the NGOs also, not only the technical capacity, but we have built their financial and managerial capacity also, so that they can be further sustained. It is important. It is not only that we have given the task to them and we have not followed them, we have not monitored them. At every day, we have a regular system to interact with these NGOs also, to have the regular feedback mechanism, to update them, whatever the changes are there, whatever the government of India priorities are there, because priorities are also changing regularly with the government of India level because we are using the different age group. Initially, when the program was started, it was with the healthcare worker, frontline worker, then 60 plus, 45 plus, 18 plus, then 12 plus. So on the regular way, we have to onboard our NGOs in the field. So we have built the capacity also to engage with the community as per the guidelines which were issued by the government of India or the state government. So I think it was a really credible experience what we have with the partnership with the engagement on these local partners and utilize their strength in the field to improve the COVID vaccination. I think and this model should work for future activities, what I expect to sustain, whether it is standing or routine medicine or other health system program which are required to use these resources for further improvement and the health indicators of the country. Over.
So, this year's World Immunization Week's theme is the Big Catch Up, wherein the focus is to accelerate rapid progress in countries to get back on track to ensure more people, particularly children, catch up on the missed vaccinations. Can you reflect on the lessons learned while implementing the COVID-19 vaccination drive and how these could be further leveraged to implement the focus of the big catch up?
Yes, it was rightly said. The pandemic has really affected multiple health programs, including the routine vaccination. There was globally setback in every country. Routine vaccination was affected due to pandemic of the COVID-19 disease. So this World Immunization Week under theme of Big Catch Up, it is important. It has created the ensure that people, particular children, are protected from the vaccine preventable diseases. So the vaccination now, as we are seeing, the COVID cases are decreasing in country also, and we have a good vaccination coverage in the country. I think our team should now focus on the children who have not received the vaccine due to any reason during the pandemic, or who are left out or drop out due to any reason, should be supported by these activities and to prevent them from vaccine prevented disease so that they can live life healthier and happily. So some of the key lessons which were learned for this specific, because the COVID-19 vaccination was the adult vaccination. So definitely there are we have addressed the cultural beliefs and vaccine related behaviors for the routine vaccination. What do we think the areas where we have utilized for COVID-19 vaccination can be helped for strengthening routine vaccination also, like engagement of the faith-based leaders, because they are able to convince the community for COVID-19 vaccination. These faith-based organizations can now be utilized to create awareness in the community to reach the children who are left out or drop out due to COVID vaccine, whatever the reasons may be, and receive the vaccine to prevent the child from vaccine-prevented disease and prevent from mortality and morbidity. So the faith-based organizations can be utilized for this important activity. Social media platforms can be utilized for this, because social media listening is important for COVID-19 vaccination, because we have utilized the alternate method. When there was a lockdown, we are not able to reach those. So we have used the digital platforms also to reach the community in that particular area. So social media platforms can be utilized for the particular area activities. The NGO network, what we have used, I think that network can help us to improve RI activities, because these are the same pockets where we are not able to reach for COVID-19. Definitely, we are not able to reach for the children also in that particular community. Definitely, when the communities are there, the children are there. So this engagement, how we are able to reach the last mile to the mobile teams or other resources what we have provided for vaccine delivery, I think those methods can be helped to leverage the communities for standing RI activities in the areas. The digital platform is important, like COVID platform we have utilized to register the new beneficiaries, to plan the sessions. I think similar methods can be used for standing RI activities for children who are missed their doses for whatever the reasons may be. The government of India is working on that, how this digital platform can be leveraged for these activities. Special days, we have utilized the special days to create awareness. So the similarly, if there any occasion is coming, any festival is coming, the special days can be utilized for the particular activities, whether it is Mother's Day, Health Day, Independence Day, and we can do the community engagement areas in the particular area. How we can engage the community leaders, the PRIs, who are supported for this activity, can be utilized for RI activities also. So communication materials, what we have designed in local languages, I think we can work on those particular areas, how these communication activities can be further strengthened for the activities. The political commitment, I think that was an important aspect. The review mechanism at the highest level, and that can be done at the national level and the state level for RI activities also. So different methods which were opted for COVID, I think there are multiple learnings which can be utilized for this particular strengthening of routine vaccination to prevent the children from vaccine prevented disease. And I think the partnership, local partnership is very important for this. So we have to strengthen this partnership to improve the routine vaccination activities overall in the particular area. So I think during this big catch-up campaign for the missed vaccination, I think we should all should come together. The society should come together to reach those last mile who have missed the vaccination due to whatever the reasons may be, to have the equitable access for the community engagement and the clear commission with the flexibility, so that we can reach the last mile to benefit the children from preventing them from mortality and morbidity from the vaccine preventable disease. Because vaccines are important and they prevent many vaccine preventable diseases. Earlier, there are limited vaccines over there. Now, newer vaccines have been incorporated in the program. So there are multiple vaccines which are there, and from the multiple disease, those vaccines are preventing the children to save their life. So this is important. I think all the activities what we have done, we should leverage the lessons learned from the COVID-19 to improve our routine vaccination, especially the children who have left the vaccine and the 5 children. That's important, because the measles cases are now coming. Means outbreak are reported in some of the areas. That was the result of the missed vaccination in those particular communities due to COVID vaccination. But I think we should focus on these areas and improve the RI activity in the particular communities which have left the vaccination. What?
Thank you, Dr. Soni, for sharing such insightful information. And as we conclude this episode, would you like to share some key takeaways and learnings from the COVID-19 vaccine rollout to improve other immunization programs?
Thank you for this. I think this joining today for this insight from the MRIT project. So definitely, I think this project has supported a lot of activities for COVID-19 vaccination, and our teams are still in the phase how these learnings can be leveraged for RI activities because RI was impacted due to the COVID-19 vaccination. So definitely, I think the lessons what we have learned with the local partnership, whether it's a faith-based organization, whether identifying the community leaders, the focus on the special community, how we are able to reach those last mile delivery through boat clinics, motorbikes, four-wheelers, whatever the sources, camel cars, whatever the sources are been there, I think those all those resources can be utilized to improve RA activity in this particular area. And I think it is important for everyone. The society should come together. The community should come together. What we have done in the COVID vaccination, I think we can do for COVID this vaccination for the children under 5 years also to prevent the children from mortality and morbidity because they are the future of the country and we should prevent them from the vaccine preventable diseases by providing the timely vaccination and at the time, correct place and correct times. So that's all from my side. Any question, anything?
So, thank you, Dr. G.K. Soni, for joining us today and sharing valuable insights into the Momentum Routine Immunization Transformation and Equity Project. Your work is making a significant impact on improving COVID-19 vaccination and further leveraging the learnings to improve routine immunization coverage. We really appreciate your dedication to this cause. We look forward to hearing about the continued success of the Momentum Project in the future. Thank you again for joining us. So, that's all for today's episode of SPAG Fin Dialogue Podcast. I hope this conversation on ensuring vaccine equity has been informative and thought provoking. If you enjoyed this episode, don't forget to subscribe to our podcast. You can also visit our website www.spagdialogue.com to stay up to date on our latest content and join the conversation on health and technology. Thank you for listening, and we look forward to bringing you more engaging discussions in the future.